We're going to go ahead and get started tonight. And first up, I want to welcome Lisa Calkins. She is our CEO of BioTrak Health, and she is going to talk to us about the Easeday platform.
So thank you. I am Lisa Calkins, the CEO of BioTrak Health, empowering fewer pain days with our biofeedback enhanced digital therapeutic platform. There's numerous problems that patients and consumers face in having migraines, tension, and stress headaches, and now even long COVID headaches. Many times the drugs are only 50% or less effective and have quite a few side effects. 88% of the patients are not satisfied with the care that they receive. And out of the almost billion worldwide user or migraine sufferers, 75% of them are women, and they're of the ages of 25 to 45. So when they go to their primary care physician, they're just not receiving the type of care and recommendations that they'd like to. Although biofeedback clinics have been proven to help, they're both expensive and inconvenient. From the B2B model, employers are concerned because migraines are the second leading cause of missed work days, and a family that has a migraine sufferer has 70% higher healthcare costs. We have a clinical grade solution. We're on version 3 of our solution. And we have a fully functioning application that includes many aspects of it. Some of our differentiators are that our therapy and education sessions, there's over 250, they have been curated by experts in the field, and they really do provide help not just in migraines and headaches, but also training exercises in a lot of the comorbid conditions. Relief Now is a often used function in our application, and it helps by using data that we have, that the users have inputted, in addition to the sensor and analytical data that we have. It helps users understand that period of time, the prodrome period, prior to getting a migraine, and it gives them some tips, it gives them some tools, and it helps them in that relief mode based on the type of condition that they're experiencing. I'm also really excited to share that through the phone app itself, we were able to integrate heart rate variability, and that's HRV, that's our biofeedback component in our app. It's strengthening the parasympathetic nervous system's control over the stress response. And if you have an increased HRV score, you will have stress resilience, it'll have improved cardiovascular health and a longer lifespan. Lower HRV scores have been shown to have increased inflammation, chronic pain, and depression. So by increasing your HRV score, you can have fewer headaches, reduce pain, and improve overall wellness. How do we know that this is the case, and how does HRV help? Well, there are many studies, and then this meta-analysis, which has been shown to actually have demonstrated that the heart rate variability in headache patients, as compared to the control group, is actually significantly lower. And so the goal of our application, of course, is to increase that heart rate variability. Also, here on the right is another analysis that shows that biofeedback, which of course we have built into our app, in addition to relaxation, has been shown to be one of the most effective treatments for migraines and stress headaches. We also have performed a pilot study, and although it was a very small sample, it also showed that users of our app could reduce their headache frequency, and they also were able to significantly improve their MIDAS score, which is an industry migraine assessment score that's used in the field, and both of those were apparent in our pilot study. In addition, we have direct feedback from our app users. 60% of them are showing that they are sharing with us that it's preventing or reducing their headaches. And a whopping 78% is saying that it's helping them manage headaches and migraines. And I'll be excited to share in the near future our results of our clinical pilot with the Cincinnati Children's Hospital's Medical Center. They're addressing stress and migraines in the teenage and young adult segment, and we've gotten a lot of really great feedback already from them related to how our app holds up against other things that they've seen in the industry. We started as a hardware company, so back in 2016, we worked with having a headband in addition to our mobile app. And then as the hardware has advanced in the mobile phone, we did a pivot back in 2019, and we were able to launch on the Apple Store with no hardware. In fact, version 2 added HRV, and it uses the heart rate variability, our trainer tool, and it uses only the phone. I joined the company in 2020 and thrilled to share that we were selected to be part of the ISO Ventures group, and that ISO Ventures startup group allowed us to really build a lot of relationships and networks in the industry. They focus on biotherapeutics solely in their investments. And the relationships that I'd like to share with you that we've developed in the past year and a half are that Kaiser Permanente in their Southern California headache training centers, they reach over 500,000 patients a year, and they recommend our app in their training. They pass out cards and give them flyers, in addition to, of course, it being in the content. And then I'm thrilled to share that we are in the beginning stages of a pilot program with Ball Aerospace, trying to help with their, of course, employee wellness. And so it's part of their employee wellness program. And again, we're in the early stages of that. Obviously, we have a very robust team, but I'll highlight just a couple that I think are key. One is when you're a mobile app, understanding how you're going to do your user acquisition in the marketplace is really critical. Our Chief App Growth Officer is Patrick Omori, and Patrick has direct experience with Calm. And obviously, there's a lot of synergy between the efforts that he had done with Calm early on and where we're at. In addition, we have two of the leading experts in the field with Dr. Richard Lipton and Dr. Dawn Buse as advisors into our company. And thank you very much. I'm happy to answer some questions.
Great. Thank you, Lisa. Again, for those of you that are in our audience, we would love for you to put any questions in the Q&A function of the AirMeet platform. That's just to the right of your chat. And in the meantime, Lisa, I would love to hear a little bit more about, you mentioned some upcoming pilots. Tell me a little bit more about those relationships and what endpoints you're looking at with those pilots.
Yes, so the University of Cincinnati one with the Children's Hospital, they not only are interested in potentially rolling out, of course, the application after it's gone through the pilot and shown positive results to both their network as well as all of their affiliated networks. And so it's quite an exciting relationship and partnership to be working with them. And it was really the chief innovation team there that has the relationship with us and that is excited about bringing us on board. So we have a great relationship with them. And then again, obviously we're a B2C company, but our B2B play is really going to be, always takes a lot longer, but the fact that we're starting with hopefully the relationship that we have with Ball Aerospace and their employees and their wellness program would really be a great jumpstart into all of the employer, especially ones that have self-insured employer areas are going to be really strong for us.
So you mentioned B2B and B2C. Can you talk a little bit more about your business model?
Absolutely. We are definitely a B2C play. We're up on the App Store and we're a subscription-based model, so very similar to Calm. We're actually priced similarly to Calm. Our retention rates, though, for our B2C application are almost twice that of the industry average. And that has a variety of factors, but obviously people who are using health and wellness apps may or may not have as many driving factors as those that suffer from tension headaches and migraines. And so we see our retention numbers really actually almost double that of what those are. So our B2C play is strong, and we run in the mobile app user acquisition space. It's pretty much just a numbers game. You have your cost per user acquisition, which ours is below $3. In fact, we were hitting around $2.50 throughout this past year. That's a really strong number. With strong retention, you get a high number in your subscription. But a B2B and a relationship to drive more adoption, both through Kaiser, of course, as well as we're in Kaiser in Southern California. Of course, we'd like to be national with them, nationwide. And then with Ball Aerospace as just an introduction to it. So quite excited about our trajectory that we are on.
Great, and you mentioned a couple of your current partnerships. One of our audience members would like to know about any future partnerships that are on the horizon, as well as growth projections.
Yeah, so obviously there's some that are early on and have showed some interest. I think that many in the employer area are always in that wait and see the results from the one that we have with Ball. And then I would say that we've gotten some really positive feedback from quite a few of the different channel marketing companies that we have worked with in order to kind of drive it. So it's everywhere from platform plays that use that are helping with self-insurance to we have a relationship with Aura Ring that we're integrating with their hardware directly into our app. Of course, we do Apple Health Kit as well. So I think those types of relationships will continue to lead us to additional user adoption.
Great. And another question from our audience tonight. Is there a possibility for this to be covered by insurance outside of those specific employer contracts?
Yeah, not at this time. We're not seeing that as a path. And part of the reason why is because 88% of the people going to their primary care physicians aren't receiving that type of a care. So at this time, we're not following that path, but that doesn't mean that we're opposed to looking at that in the future.
Excellent. And I know you're currently focused on headaches and migraine kind of in that entire spectrum, but I'm guessing this technology might be useful for other indications as well. One of our audience members brought up seizures and folks with seizure disorders as a possibility. Have you thought about other indications, and what might you have in your pipeline?
Absolutely. In fact, that's the reason we've built a platform that enables both sensor data, the HRV tool, which our training tool really does help drive. It's not just an HRV monitoring, which is what a lot of applications have. It actually teaches you and trains you to improve that HRV score. And HRV has been shown in many applications that are also comorbid with, of course, headaches and migraine. So it makes a lot of sense to be driving some of those additional areas. And there's a couple of them, of course, anxiety and depression are high in lots of lists, although there may be some that are even a little bit smaller markets, but also still important, whether that's TMJ or some of the other ones like that. So.
Great. And I know, because you and I have talked about it a little bit, I think in the medical community, there tends to be some skepticism around the use of biofeedback, and you presented some good evidence on its efficacy with chronic pain, and I'm assuming other disorders as well. How do you think that's impacted your business overall?
Yeah, I think that is education is going to be really important in this field. Migraine and migraine research has been underfunded for quite a time. In fact, that there was a very big CNN special early in the year around this being a women's health crisis. And so things aren't a women's health crisis when there's a lot of education around the tools that are out there to help in this particular area. But this isn't new research. This research has been around for quite a long time. And so the body of work that is out there that shows that this can be helped with both HRV and these curated sessions is deep and rich. And of course, I have lots to back that up, and I'm happy to share, as well as our CMO will be in the question and answer session at the end for very specific medical questions related to how does that technically work and more around the data. But education really does matter in this space, and I know it does for many startups, and then we're no different in that particular area. So thank you for asking.
Great. And I know there are a few more questions from our audience. As Lisa mentioned, and for those of you that this might be your first pitch club, we will have 30 minutes of networking time after our pitches are completed where you will be able to ask those questions we may not have gotten to in the Q&A. So Lisa, thank you so much for being here this evening and for telling us all about BioTrak Health. It's very exciting, and to your point, I think that headaches in general, migraines specifically, impact a large number of patients. I've seen that for sure in the pediatric realm as well.
Thank you, Katie.
And